Pharmacology, cardiovascular, antithrombolytics. Chewable aspirin are used for patients experiencing a myocardial MI. Mechanism of action: aspirin inhibits platelet activation and aggregation. Indications: aspirin is indicated in patients with established peripheral arterial disease or a history of recent myocardial infarction or stroke to reduce the rate of MI and stroke. It is also indicated to reduce the rate of myocardial infarction and stroke in patients with ST elevation and non-ST segment elevation acute coronary syndrome. Considerations: it is important to remember that the effects of these medications last the life of the platelet, or 7 to 10 days, so aspirin will need to be withheld for several days before surgery or certain procedures to prevent excessive bleeding. In elderly patients, there is increased risk of bleeding events with concurrent use of clopidogrel plus aspirin. Aspirin is contraindicated in children under the age of 12 with flu-like symptoms due to the risk of Reye's syndrome. Overdose is irreversible. Clopidogrel is metabolized to its active metabolite by CYP2C19. Concomitant use of the drugs that inhibit the activity of this enzyme results in reduced plasma concentrations of the active metabolite of clopidogrel and a reduction in platelet inhibition. Adverse effects: increased risk of bleeding. Warning: reduced effectiveness for patients referred to as CYP2C19 poor metabolizers. Patient education: patients should report tinnitus, unusual bleeding of the gums, bruising, or blood in the stool to the healthcare provider immediately while on antiplatelet therapy. Patients should avoid alcohol to prevent gastric irritation. Additionally, patients should avoid enzymes while receiving antiplatelet therapy. Sildenafil, or Viagra, is commonly known to treat erectile dysfunction. This medication was originally developed for improvement of pulmonary hypertension, but has been found to be useful for additional indications. However, patients taking this medication cannot take nitroglycerin due to severe hypotension. Mechanism of action: sildenafil inhibits phosphodiesterase, or PD5, in the pulmonary smooth muscle and corpus cavernosum. This allows for relaxation in the smooth muscle. Indications for use: sildenafil is used in the treatment of pulmonary hypertension and erectile dysfunction. Consideration: dose adjustments are needed for patients with hepatic and renal impairment. Use cautiously with geriatric patients for decreased hepatic, renal, and cardiac functions. Patients taking sildenafil may expect to experience hypotension, visual or hearing loss, priapism, headache, or vaso-occlusive crisis. If patients have priapism that lasts longer than 4 hours, they should seek medical attention. Patient education: patients should be instructed to take medications as directed and should seek immediate medical attention if chest pain occurs. Patients need education regarding the need to report priapism lasting longer than 4 hours or if they notice any dizziness or decrease in hearing ability. Hydralazine. Hydralazine is an example of a direct vasodilator. Mechanism: hydralazine's direct mechanism of action is unknown, but it causes vasodilation via direct relaxation of vascular smooth muscle. Peripheral vasodilation results in a reduction of blood pressure and decreased vascular resistance, resulting in increased cardiac output. Indications: vasodilators are used to treat hypertension. Consideration: Use with caution in patients with coronary artery disease, mitral valve rheumatic heart disease, and cerebral vascular accidents. This medication should only be used in pregnancy if the benefits outweigh the risks due to lack of safety studies. Adverse effects. Patients should be monitored for infection and are at risk for developing systemic lupus erythematosus, or SLE. SLE is a chronic disease that causes inflammation in connective tissues. The signs and symptoms of SLE vary among affected individuals and can involve many organs and systems, including the skin, joints, kidneys, lungs, central nervous system, and blood-forming hematopoietic system. A characteristic sign of SLE is a flat red rash across the cheeks and bridge of the nose. This rash is called a butterfly rash because of its shape. Hypotension, palpitations, angina, tremors, numbness, tingling, disorientation, nasal congestion, headache, nausea, vomiting, and diarrhea are effects associated with hydralazine. Patient education. Patients should remain compliant with a therapeutic dosing regimen even if symptoms resolve. The patient should be cautious not to double up on medication doses. Additionally, the patient should consult the healthcare provider if 2 or more doses of medication are missed for follow-up instruction. Patients should be instructed to monitor their weight and assess for fluid retention in the feet and ankles. Additionally, the medication can cause side effects of orthostatic hypotension and drowsiness. Alteplase or TPA. Alteplase is a thrombolytic used to break up clots. It has a very short half-life of 5 minutes, so it can open a clogged artery rapidly. It is often given with heparin to prevent reocclusion of the affected blood vessel. There is also a smaller dosage form that is used to flush clogged IV or arterial lines. Mechanism of action. Alteplase binds to a fibrin in the thrombus and converts the entrapped plasminogen to plasmin, thus breaking down the clot. Indications. Alteplase is indicated for the acute treatment of myocardial infarction, stroke, or massive pulmonary embolism. It is also used to clear central lines, such as peripherally inserted central line catheter. Considerations. The drug is contraindicated in situations in which the risk of significant bleeding is greater than the potential benefit, such as active internal or intracranial bleeding, history of recent stroke, recent within 3 months of intracranial or intraspinal surgery or serious head trauma, presence of intracranial conditions that may increase the risk of bleeding, some neoplasms, arteriovenous malformations, or aneurysms, current severe uncontrolled hypertension. Significant post-administration monitoring is performed due to the risk of life-threatening bleeding. Adverse effects. This drug can cause significant, sometimes fatal, internal or external bleeding, especially at arterial and venous puncture sites. Avoid intramuscular injections and perform venipunctures carefully and only as required. It can increase the risk of thromboembolic events in patients with high likelihood of left heart thrombus, such as patients with atrial fibrillation. Patient education. Patients must institute bleeding precautions to prevent complications of therapy.